Well, good afternoon, and again, thanks to all of you for being here and for those of you that are viewing from home. Today, I'd like to provide some updates on alternative care sites, religious services, and our state budget. First, yesterday, the federal government approved the public assistance portion of our request for a federal major disaster declaration for Virginia. We thank them for that. That designation will provide us additional federal funding for equipment and supplies. It will help provide shelter for approximately 1,500 Virginians who are homeless or who rely on shelters that can't comply with social distancing. We can provide hotel or motel vouchers, and FEMA is also providing some funding for food, cleaning supplies, and medical transportation. The disaster declaration will also support our work in partnership with the United States Corps of Engineers, our hospitals, FEMA, and the National Guard to identify potential sites for alternative care facilities. Thank you, Dwayne. Sorry, sir. No, appreciate it. On Wednesday, we discussed several preliminary site options. The Corps has continued its evaluation since then, and I have approved their final recommendations. In Northern Virginia, it has become clear that Dulles Expo Center is the site where construction can proceed the fastest, making it a better site for an alternative care facility. So we are focusing our attention on that particular site. This center could accommodate 315 acute or 510 non-acute beds. We will move forward with the Hampton Roads Convention Center and with the Richmond Convention Center. The Hampton Roads Convention Center can accommodate 360 acute or 580 non-acute beds. The Richmond Convention Center can accommodate 432 acute or 758 non-acute beds. The next steps are to complete contracts, move into design, and then to construction. Teams are moving fast, and we expect these alternative care sites to be ready in about 6 weeks. I want to be clear, these facilities will be to free up capacity in the existing hospital system. And as I have said, our models look at May, the month of May, as being the time when the surge will be most likely to occur. The economic slowdown caused by this pandemic is affecting thousands of Virginians. This week, 114,104 people applied for unemployment benefits in Virginia. This is a very large number, but by next week, it will unfortunately seem small. This is overwhelming our unemployment system. People have had issues with our website. So we have upgraded our website, expanded server capacity, and we're increasing call center staffing by 20%. In addition to people being laid off by employers, we've also learned today that the Department of Labor will provide unemployment benefits to people who were self-employed, gig workers, or others who didn't previously qualify. We're also seeing more people become eligible for our Medicaid program. When we expanded Medicaid eligibility less than 2 years ago, we considered 400,000 enrollees to be a milestone we would be proud of, because it would mean people who needed health could finally get it. Well, we have now hit that number this week, but it is nothing to celebrate. However, I think we are all grateful that Virginia did expand eligibility so more people can have access to health care at this most critical time. Now I'd like to talk about our state budget and how we're handling decisions about it. Just a few short weeks ago, the legislature passed a 2-year state budget that made generational investments and ensured that we were taking care of our most vulnerable Virginians. Now, we're facing a recession, and the certainty that this unprecedented situation will have major impacts on our state budget, both the budget we are currently operating under and the new one that begins on July 1. We can expect to have significantly less revenue than even our most pessimistic forecast. And our response to this crisis requires us to make significant investments, purchases of PPE and other supplies, investments in hospital space, and aid to support Virginians who need it the most. Federal funding from this disaster declaration and from stimulus bills will surely help, but it will not fully fix the problem. So yesterday, I directed state agency heads to begin taking steps to reduce spending. We are eliminating discretionary spending for the remainder of this fiscal year. We are directing our agencies to prepare for budget cuts in the next budget cycle starting in July. And we are directing our budget experts to re-examine funding that was planned for new initiatives and avoid any new commitments. We have to rearrange our priorities now. Virginia had a strong economy and was in a good financial position before this pandemic. I have confidence that we will manage our budget responsibly through this situation, and when this pandemic is finished, we will again be strong. We know that our nursing homes and long-term care facilities can be particularly vulnerable to this virus. Right here in Richmond, Canterbury Rehabilitation and Healthcare Center has been particularly hit hard. 16 of the people living there have unfortunately died, and another 92 have tested positive. Working with our Department of Health, this week Canterbury tested all of its residents for the coronavirus. Of those who tested positive, 53 had no symptoms. They didn't know that they had this virus at all. This demonstrates how absolutely critical it is that everyone stay home and stay away from other people, because people can have this virus without knowing it or feeling sick. Our nursing home residents have no choice. My heart goes out to them and their families, and to every person in Virginia who is living in a facility or has a loved one who is. I know that it is heartbreaking to not be able to go see your mother or your father or your grandparents or even your spouse, especially if they are sick. We all have the responsibility to stay home and stay away from other people so we slow the spread of this virus. By doing this, we protect ourselves and we protect other people. We protect our healthcare workers who are on the front lines every day fighting a battle for us. As I've said before, we're in the early stages of this situation in Virginia. The actions that we take now will help shape what happens in the next few weeks and months. We can get through this, but we must all work together. I spoke today with our Department of Conservation and Recreation, as well as the Department of Game and Inland Fisheries. Together, these departments manage our state parks, our wildlife management areas, preserves, and other public lands. They tell me that many Virginians are using these parks and preserves to get outside. As an outdoorsman myself, I know the importance of our public lands and waters to the mental and physical health of Virginians. But I hear that some people are still gathering in groups and not abiding by our social distancing, in direct violation of our stay-at-home order. This puts a tremendous burden on our law enforcement, from those monitoring public beaches to those patrolling our parks and preserves. To ensure continued access to public lands and waters, Virginians must practice social distancing and avoid gatherings in these places and treat our natural areas with respect. Behavior such as parties on the beach, sandbar, or boats are strictly prohibited. So is rafting of multiple watercraft and large gatherings. So are littering, vandalism, and failing to observe post-it use restrictions. Virginia Natural Resources agencies are working hard to provide this outlet for people, but they cannot continue to do so without your help. Everyone needs to stay apart for your own safety and that of others. Do not gather in groups. We will be watching this weekend. I do not want to have to close these lands to public visitation because of a few irresponsible people. Now I'll ask Virginia Commissioner of Health, Dr. Norm Oliver, to provide a brief health update. Dr. Oliver. Thank you.
Good afternoon. This past week, the Centers for Disease Control and Prevention, the CDC, listed Virginia as a state that has widespread community transmission of COVID-19, and that certainly has proved to be the case, as you've heard with the numbers over this past week. The total number of cases we have to report today is 2,012. Since we reported to you on Wednesday, that is an increase of a little bit more than 500 new cases. The total number of deaths is 46, and that is just in the last 24-hour period of reporting 5 new deaths. The areas that continue to have the widest spread of disease are here in the central region of Virginia around Richmond, as well as the Tidewater and Peninsula region and northern Virginia, the areas in which, as the governor announced earlier, we are planning alternate care facilities to aid the hospital systems there, which are doing a wonderful job at meeting the increased number of patients with COVID-19 that they're seeing in their hospitals. One last thing. Next week is National Public Health Service Week. Normally, on April 6th of every year, we throw a big celebration for our public health workers at the Virginia Department of Health. We obviously won't be doing that this year, but I think this crisis shows us the importance of the work that they do. Folks in the local health districts have been identifying these cases. Each of these more than 2,000 cases has hundreds of contacts that we're trying to track down, ensure that they don't have the infection and are not spreading the infection, doing our best to contain this pandemic as best as we can, and those frontline workers deserve our gratitude, and I want to say here now, thank you.
Thank you, Dr. Oliver. On behalf of Virginia, please extend our thanks to all of these hardworking individuals. Before we take questions, I want to return to an issue that I raised on Wednesday. We are entering what is normally a very busy period for our faith communities. Easter, Passover, Ramadan, and other religious holidays fall this month. Normally, our faith communities would celebrate those important times together, but these are not normal times. We have developed additional guidance for our faith communities, urging them to use alternative means of worship, such as virtual gatherings or drive-in services. I know the requirements of social distancing are hard on communities that rely on togetherness. It's hard on all of us, whether you are of a particular faith or no faith. We all lean on the people around us. These relationships are more important now than ever. So I've asked my own pastor, the Reverend Kelvin Jones, who is the minister at First Baptist Cateville Church on the Eastern Shore, to share some of his thoughts with you. Reverend Jones, welcome. Thank you.
Good afternoon, and thank you, Governor. I would certainly like to take this moment to thank our governor and his cabinet for their leadership during the COVID-19 crisis that has impacted the Commonwealth as well as the rest of the world. Thankful that we have leadership that listens to the data and those that are in the medical profession as they help to maneuver us through these uncharted waters that we're in. Also, as I would like to thank as a Virginian to have the leadership that has a relationship with a power that's greater than self, and have faith to believe that the power we got will guide us through these turbulent times. I admonish us to heed the voice of our governor, the healthcare professionals, and other officials. Virginians, this is not the time for us to become angry nor frustrated. This is not the time to perceive the government as a means of which trying to control our lives, but we should see them as trying to save and preserve our lives. I am sure that for many of us, sheltering in place has been difficult. We are used to moving freely without restrictions or instructions. However, this could be the time for us to push the pause button and hit the reset button of our lives and concentrate on our faith. Over the past few weeks, much of what is normal for us has been stripped away. COVID-19 has stripped us of family and of good health. But the one thing that cannot be and will not be taken from us is our faith. It is imperative that we hold on to it now tighter than ever before. Our faith may get tried, it may get tested, but I'm here to share with you that we will not break. Virginians, faith will sustain us. It will be our calm as the days get chaotic. It will be our salve that soothes our souls when the storms rage. Our faith will be our stimulus package long after the $1,200 is spent. The faith that will give us strength when we are at our weakest. This faith is what we must exhibit during this time of crisis, during this dark moment. And whether you have great faith or little faith, whether irregardless to where you worship or the higher power that you pray to, I challenge all Virginians who believe to activate your faith. And remember that we are the light of the world, and a city that sits on a hill cannot be hid. And this light, which is our faith, shines brightest in darkness. And no doubt these are dark days, but Virginians, your light, which is your faith, my light, which is my faith, our light, which is all of our faith, that radiates and resonates from every religion throughout the Commonwealth of Virginia, has the awesome opportunity to be one bright, unified light shining at this time of darkness. Virginians, I believe, and I have a suspicion, that on the other side of the storm, there are rainbows of hope that are on the horizon. But we cannot lose hope. We must hold to our faith. For all those who are putting themselves in harm's way every day, we must hold on to our faith. Virginians, be assured we will arise from this stronger, wiser, and better than ever before because of the faith of every religion. Let us continue to pray for our governor and his cabinet and the entire Commonwealth of Virginia and this world. And as we worship this weekend, let us be mindful to do it in a safe, social distancing manner that protects the lives of those that God has entrusted to us.
We'll be glad to take your questions.
Hi, Governor. Thank you for taking our questions today again. I've seen a lot of people in the live feed online. They're asking about rent. You addressed what mortgage holders can do and how they can get some relief. Is there anything that your administration can do about rent, or is that kind of out of your control?
Clark, you want to handle the rent issue? Welcome our Chief of Staff, Clark Mercer, to the podium. Thank you, Clark.
Yes, well, let me follow up first on the homelessness displacement issue. Obviously, you cannot stay at home if you do not have a home, so I wanted to cover that topic, and then I'll move into the rent. The governor announced that we will help up to 1,500 Virginians who are homeless find shelter during these trying times. And we put the word out to the private sector, our hotels, to see if they would be willing to accept individuals displaced during this time. And in the last 24 hours, I'm very happy to report that we have over 500 hotels throughout the Commonwealth that have over 37,000 rooms available who are willing to assist the Commonwealth. And I wanted to specifically thank our Secretary of Commerce's team, our Department of Housing and Community Development, the Virginia Restaurant, Lodging, and Travel Association, and our Asian American Hotel Owners Association. As for rent, there's a variety of tools that we have availed ourselves of. Obviously, the Supreme Court has suspended court proceedings, so no one will be evicted during this crisis. Our Virginia Housing and Development Authority is the financing arm for many, the majority of our multi-family tenant and apartment buildings throughout the Commonwealth, and they are using all the tools that they have at their disposal to keep individuals from being evicted during this crisis, and they're getting cooperation from all those folks who do business with the Virginia Housing and Development Association. So there are many efforts through the courts and also through the lenders and banks to make sure that folks have a roof over their head during this crisis.
To the public about wearing cloth masks in public, and then the legality behind that too, because technically face coverings are illegal in the Commonwealth. So what's your guidance on all of that?
Yes. The question is, what about wearing cloth coverings of your face when you're out of your home, and the enforcement, because as you said, Henry, that it is unlawful to cover your face in public. First of all, let me address the second part of that. We know that during times such as these, that people are going to need to protect themselves, whether they have symptoms or not, and so no law enforcement will be bothering anybody because they have a covering on their face. I can assure you of that. As far as the need for that, I want to back up just a second and address the PPE situation. We are still asking anybody that can volunteer PPE to do so. We are working with vendors, not only in Virginia, but around the world to provide PPE. So we want to make sure that the masks, the N95s are available for those that really need them, and those are our first responders, our healthcare providers, individuals working at our nursing facilities, nursing care facilities, et cetera. But if someone has a scarf or another means of covering their face, we know that this virus is transmitted by droplets, whether we're coughing, sneezing, even now breathing. Some of our epidemiologists have told us so. So I certainly wouldn't discourage anybody if they're out of their house for an essential reason, especially if they're around other individuals, to cover their face. I think it not only would protect them, would protect others around them. So I would encourage that to happen.
Roger Watson with the Farm Bill Herald.
Thank you, Governor. Continuing on the PPE issue, in Wednesday's press conference, it was assumed that shortage would be solved before the hospital expansion took place. The fact that you only got a fraction of what you requested from the national stockpile, does that affect how the expansion, how quickly that can happen?
Yes. Thank you for the question. The question was about PPE. What's in the pipeline? Will we have enough when we see the surge? Dr. Carey, I'm going to allow you to answer that. Thank you.
Thank you, Governor. We are committed to finding every amount of PPE, scouring not just Virginia and the U.S., but internationally. So we are committed to help our health systems, our providers, our first responders, our social service workers who need to go into the home, to get them the PPE they need. We are always planning for that next surge that we have to make sure that's there. So even as we plan for alternative treatment sites and how we can better assist our health systems as they do their surge, we have to make sure that we have all of those elements, that we have the staff, that we have the space, that we have the supplies, as well as the systems to provide that care. So we realize that supplies remain an issue, but we are committed to making sure that when those supplies are available, that staffing and space are no longer a constraint. So we are moving forward on all those fronts because we just have to make sure that we do everything we can to be prepared.
Yeah, also on the PPE issue,
Based on the FEMA data released yesterday, it appeared that states like Maryland and D.C. were ordering ventilators earlier than Virginia was within their first 2 orders. And I was wondering if there was a reason Virginia didn't do that. And then on PPE specifically, could you talk more about the state suppliers outside their strategic national stockpile and whether those orders are coming in consistently or if they're sort of filled piecemeal?
Sure. We'd have to look back to the exact date. I know that the VEST, the Virginia Emergency Support Team, ordered 350 ventilators from the national stockpile, as well as attempted to place an order for 350 in the private sector, and that has not been able to be filled. I also will say that our health systems are also reaching out to all of their supply chains, and hundreds of new ventilators are now available in the Commonwealth. So we are all trying to increase the numbers of all the protective equipment, and including support equipment like ventilators. So I hope that answers your question.
Kate, just to follow up on that too, we are also looking at innovative ways to better use the ventilators that we have. For example, using valves to take care of more than one patient at a time. So a lot of that is in the process, and we are doing everything that we can to, again, when we know that we'll, or at least expect to have the surge, that we'll not only have the bed capacity, but also the equipment to include ventilators and also the staffing that we need. So all 3 of these areas are being worked at one time.
Progress Index.
Thank you, Marissa. Governor, the police chief of the city of Petersburg took to Twitter this week to express concern about the essential classification of ABC stores being open. He posted on Twitter and a question directed to you. Quote, if you want people to stay home, remove adult beverages from state shelves, unquote. Now, it's possible he could be having some local emotional reaction to that because of what happened last weekend on 95, double fatality, where a wrong-way driver from Petersburg is facing DUI charges. But have you heard from law enforcement agents around the state on this, and how would you respond to the Chief Miller's concerns that he's saying? And also, could you also answer the public interpretation that part of the reason for the store staying open is that to help lower the traffic at emergency rooms due to substance abuse patients suffering from DTs?
Could you ask him to repeat the second part of his question?
Bill, can you repeat the second part of your question, please?
Sure. Can you also answer the public interpretation around that the part of the reason for the stores staying open was to help lower the traffic at emergency rooms around Virginia because of the possibility of substance abuse patients suffering from DTs and having to get emergency care?
Yes, the second part of your question, are we maintaining ABC stores so people can have access to alcohol to prevent the symptoms of withdrawal? And absolutely not. And I would encourage anybody or any family that is having issues with substance abuse to talk to their physician, talk to their counselors, etc. As far as the ABC stores remaining open, and we are treating them like any other retail. If they can maintain their business with maintaining the 10 or less individuals in a confined space to promote the social distancing, then we are allowing them to stay open.
Hi, yesterday you mentioned that an ExxonMobil site near Inova Fairfax would be selected as overflow in Northern Virginia. Can you talk about that site, and are we stepping back from that as an option?
The question is about the ExxonMobil site in Northern Virginia up in Fairfax. Yes, we are stepping back from that. We're using the Dulles Expo Center. As far as preparing those 2 buildings, we thought that the Dulles Expo could be prepared in a much more reasonable time, and so that's why we made the decision to use that rather than the ExxonMobil.
Greg Hambrick with Inside Nova.
Governor, staying on that topic, how confident are you that these alternative care sites will meet the needs of the surge? And are you preparing any secondary sites in case you need additional resources?
Sure. The question had to do with, as the governor designates these three first sites, one in Northern Virginia, one in the Richmond area, and one in Tidewater, how confident are we that that's going to take care of all of the needs of the surge? And second was the question of what other sites might be investigated. So first, we are, the first line of defense is in the state's plan is really the health system's own plan to surge their capability using their four walls and adjacent properties to maximize their effectiveness of their own staffs and beefing up those staffs as they are able, as a number of systems are, bringing in staff from surgery centers and other places that are no longer performing surgery. So that is the first line. And the second is a pop-off valve. The design of our surge plan is that to make sure that we can have a place that when a health system is taking care of a patient, they are almost ready for discharge or towards the end of discharge, we can get them out of that facility as they take care of the sickest patients. So to have large numbers of spaces strategically placed throughout the Commonwealth is critically important. When you look at those curves, there's a lot of variety between the numbers of beds that are surging and also the number of beds that the governor mentioned. So we're reevaluating each day what our needs are, but those are the sites that we are most confident of and the sites we're moving forward with today. The Corps of Engineers continues to look around the Commonwealth, now looking a little westward and southwestward as they may come under stress to look to see what the needs are and how we might best fulfill them.
Thank you, Dave.
Yeah, so we've obviously been talking a lot about homelessness and homeless day. I know our newsroom has heard of at least one healthcare worker who, is obviously going on the front lines, interacting with patients that have COVID-19, and then having to go home to their families and have that concern. I believe some states have started to set up these healthcare workers in hotels and other accommodations like that. I think discussion about a similar protocol in Virginia.
I don't think we have anything specifically, but the question is, what about our healthcare providers that are exposing themselves to the possibility of contracting coronavirus when they're at the hospitals and nursing homes? And, I think it's a great question, and we haven't set up anything specific, but I think there would be the option, certainly working with our hotels, other folks around Virginia, that we could certainly find them a place and help them find a place, certainly, if they have that concern. It's, having been in that world, being at the hospital every day, coming home to your family is a real concern. And just personally, I would always use good hygiene, wash my hands, change my clothes, do those types of things, kind of common sense things. But if there are individuals that have that concern, we would be glad to work with them.
Julie Carey with NBC4.
We've been listening to Virginia Governor Ralph Northam with an update.
Hi. As you may know, the District of Columbia today released its modeling data. And it shows a somewhat dire picture ahead. If you are trying to drive home the importance of compliance, why hasn't Virginia done the same and let folks know a little bit more about what our modeling data shows?
It's a great question, Julie, and thanks for asking. The question is about our modeling, and there are obviously different models. We look at all of those, as I've said to Virginians every day. I'm all about data. It is not a perfect science by any means, but we are analyzing data that is coming from other countries that have experienced this, looking at their curves, other states, cities such as New York. Again, it's not a perfect science, but our best estimate is that the surge will be in the month of May. We're not sure whether it's early May, middle, or late May. If people want access to these curves, I don't think that those are classified. I think they're available on different websites, and I think people are more than able to do that. As far as what we're thinking, what the science we're using, the data we're using, we're giving that information to you every day. And as I've just said, Our best estimate right now is that the surge in Virginia, and again, every area geographically in the world is different, but our estimate is that, and what we're preparing for, is that our surge will be in the month of May.
One more, so just to build on that, when you're talking about timing, but in terms of, say, the share of residents, Virginians who might get it, I think what caught people's attention in D.C., as Mayor Bowser said, maybe 1 in 7 people could be expected to get it. I don't know if you've done that type of projection and if you'd be willing to share it.
Yeah, I don't have a 1 in 7, Laura. I think the question is, how many individuals will get it. The point that I would make to Virginians is if you don't abide by our guidelines, if you don't stay at home, if you don't practice social distancing, if you don't wash your hands frequently, and you're in the vicinity of someone that has coronavirus, you're going to get it, period. This is one of I was talking to some folks earlier today. I've been in this business for over 30 years. I don't know that I've ever seen a pathogen, whether it be bacteria, virus, whatever, that is contagious as this is. And again, I would just assume that if you're around other people, that there's a good likelihood that someone is going to have the virus, and you just need to follow our guidelines. We were pleading with Virginians to do that, and if we abide by those, we know that those work, and that will cut down on the risk of being infected, and it will also flatten that curve so that our hospitals aren't overwhelmed when the surge does occur.
Governor, of the models that are out there, are there any that you would point Virginians to if they want to get a better sense of that curve that you're talking about?
Does anybody want to talk about the different?
Thank you. There are models that come out of the University of Pennsylvania called the CHIME model that really models hospital bed utilization. It does have some outcomes in terms of numbers of people, and you can get their projections around Virginia. The University of Washington has another model that paints a rosier picture, and you can look at that. Probably a month and a half or so ago, the Imperial College of London produced a model for the U.S. that you could also look at. The University of Virginia Data Science Institute has a research team that did work for the Defense Threat Reduction Agency and produced a model for them. The Virginia Hospital and Healthcare Association and the Virginia Department of Health have provided them with Virginia-specific data, and they are hard at work producing a model that will use that Virginia-specific data to generate a model that will more than likely be a better estimate. Remember, however, that models are models. The map is not the same as the territory. We've all used our GPS and been told to take a right turn when there was not a possibility of doing that. So take that into account when looking at these models, that they're not a prediction, absolute factual prediction of what will actually happen. It's a best guess using all kinds of assumptions and so on. You need to understand what those assumptions are. So take it with a grain of salt.
Again, I thank you all for being part of the discussion today. I hope that all Virginians can continue to abide by our guidelines, and also hope that all Virginians have a safe and peaceful weekend, and we will look forward to talking to you again on Monday. Thank you all so much.